So clinical trials are studies that people like myself, doctors, do that try to help people with a certain affliction. There are companies out there that have products, and these products are being tried in different populations to see if they really work or not. So why do I want to do that? Am I going to be a guinea pig? No. I like to tell people that by being involved in a clinical trial, you're going to have access to care you might not get elsewhere. Hi, thanks for joining me again today. I want to talk today a little bit about clinical trials. What is a clinical trial, and why should I even think about that? So clinical trials are studies that people like myself, doctors, do that try to help people with a certain affliction. In my case, we talk about foot. So there are different clinical trials, different studies that deal with different problems of the foot. We talked about bunion deformities. We talked about diabetic foot ulcers. We talked about diabetic foot infections, whether it be osteomyelitis, bone infections, or maybe it's just what we call cellulitis, just the skin around it is infected. There are companies out there that have products, and these products are being tried in different populations to see if they really work or not. So there are different levels of clinical trials. We start out level 1, 2, 3, and then even we have level 4s, and each one has a different aim to it. For example, when we start out in phase 1 trials, those are the trials that are being done on patients that have no diseases, but the company wants to see if the medicine will affect them in any way that's not good. So many times there'll be a group of patients, subjects, we call them in research, come in, have the treatment, and then they're monitored to see how that treatment affects them. And then the phase 2 is when patients with the problem, let's say a diabetic foot ulcer, come in, and they're usually a smaller number of people will try the medicine or the product and see how that goes. And once you have those two done and you have clearance, which means you've seen that it hasn't hurt anybody and it may help, now you go on to phase 3, which is the larger trial, where you have maybe 700, 400, up to 1,000 people involved in this study. And what we're trying to see if this company's product or medicine will help the subject with the problem that they have. So why do I want to do that? Am I going to be a guinea pig? No. I like to tell people that by being involved in a clinical trial, you're going to have access to care you might not get elsewhere. You may not be able to afford, let's say, a placental graft to help with your diabetic foot ulcer. These grafts can cost up to $5,000 each one. And with a clinical trial, you're getting them totally free. There's never a charge at Fututo Clinical Trials when you're in one of our trials for any of the materials or any of the care. And so that's one advantage of doing clinical trials. The other advantage is you're going to be getting state-of-the-art care. And you're going to be getting, at the very least, what we call standard of care, which is what you would get if you came to my clinic. Now, there always are risks involved with every treatment, whether it's been done in a clinical trial or if it's being done in a clinic setting. And when you come to see us, you'll get what's called an informed consent. And that will explain very easily in language you can understand what's going on and how this clinical trial is going to work. And so if you have an affliction, if you have a diabetic foot ulcer, you have a bunion deformity, you have maybe a fungal toenail, or you have a bone infection, you might want to call Fututo Clinical Trials at 999-8399 to see if we have a study that can help you with that. You can also look for us on the web at fututoct.com and look at our webpage, and it tells you what we're actually doing now, what trials we have going on. So remember, a clinical trial is a study of a product, a medicine, to try to help this subject with the problem that they have. Come talk to us. We'd love to share more with you. Have a nice day.